In this video, I'm going to discuss the often thrown around insult of physical therapists that are exercise forward being glorified personal trainers. I'm Dr. Joe Camerato. I'm with Across The Continuum, and it's my goal to make you a better strength coach as a physical therapist. There's an unfortunate trend in the physical therapy world that occurs towards physical therapists that are exercise forward or heavy on their use of periodization and activity over other types of interventions. They get called glorified personal trainers as a means of denigrating their practice, somehow insinuating that leaving out passive interventions like manual therapy or modalities somehow makes them less of a physical therapist. To say that differently, these physical therapists seem to be insinuating that the inclusion of things like manual therapy or passive modalities or passive interventions in general somehow makes you a physical therapist. The issue that I take here is that everybody is missing the point as to what makes you a physical therapist. Mainly the expert and advanced understanding of the musculoskeletal system, both in the functioning or symptomatic and injured state. The tens, if not hundreds of thousands of dollars spent on the doctorate level of education that is the DPT is not won or lost if manual therapy or massage is included or not included in a plan of care. There's no deterioration of the value of the degree simply because somebody chooses to prioritize more active or exercise forward plans of care or interventions. In fact, I'm here to make an argument that being in that glorified personal trainer camp has more of a robust health effect on patients than not being in that camp at all. I mean, there's no secret that there is a dose-dependent response that comes from physical activity and exercise when it comes to health byproducts in both resistance and aerobic training. What this means in the equation of health is that when we put more physical activity like resistance training and aerobic training in the front end of the equation, more health benefits come out of the back end of that equation. If we continue to pull on this thread, we can see how prioritizing anything except for physical activity is going to be putting less physical activity in the front end of that health equation and subsequently less health coming out the back end of that equation. This is simply due to the nature of the length of the session that a patient has with a physical therapist, as well as the frequency or how frequently that person is seeing that physical therapist. If we're prioritizing things like passive interventions and modalities or manual therapy, there's just no time left over for those things that are going to have that robust health effect like physical activity and exercise. This is not to say that passive care has no place in rehab. I'm simply pointing out that if we prioritize anything other than physical activity, there's a change in what comes out of that health equation. With the additional understanding that physical activity does just as well as any other treatment as far as symptom modification goes, my question to you is why wouldn't you prioritize physical activity and exercise as your intervention? Simply put, if anything is going to help with symptoms, why not use a thing that has a robust secondary effect on the morbidity, the mortality, the disability, and almost every system in the human body that we can list out here? My question to you is, what are your thoughts on this scenario? Do you feel like glorified personal trainer is an insult or a compliment? And how much of your treatment sessions are you really spending on physical activity versus things that aren't really pushing the needle of health forward? Let me know down in the comments if you feel like the glorified personal trainer is an insult or a compliment, and which camp you fall into, and how much of your treatment sessions you're really spending on things that are going to be pushing the health needle forward in an objective and measurable manner. And as always, if you enjoyed this content, please share it with your coworkers, share it with your physical therapist friends, and subscribe to my channel.